Now, in depth on the biggest entertainment stories from around the world.
Now, my exclusive conversation with the Beverly Hills plastic surgeon who is in the headlines for reportedly refusing to operate on Whitney Houston because she failed a health exam 2 weeks before her death. So what would have disqualified the singer? Well, today, Dr. Marc Mani answers those questions. What parts of your body get damaged from drug abuse?
Different drugs have different effects on organ systems. Alcohol affects the liver, and they may have a problem with bleeding because of that. Drugs like cocaine will cause cardiac complications, so that can cause a situation where a patient would have a heart attack under anesthesia. Just cigarette smoking also can be a contraindication up front to certain types of surgery. But the main issue is the patient's fitness for general anesthesia.
Dr. Mani, like all reputable plastic surgeons, requires his patients to have a battery of tests, including an EKG for the heart, chest x-ray, and lab work before surgery is performed. The drugs that are the sedatives, the drugs that are the anti-anxiety medications, would those cause you to have damage to your body that would not make you want to have surgery?
The more prominent concern with, for example, anti-anxiety medications, you will see what the results are of the autopsy of Whitney Houston in this case. Those drugs like Xanax, for example, Valium, when combined with excessive alcohol use, can cause respiratory suppression, and that can cause someone to pass out like it seems Whitney Houston did, and I think that's one of the things that they are probably looking at to determine the cause of her death.
What do you think about the reports being out there that Whitney had come to you for plastic surgery and that because of her failing a medical exam, you turned her away?
I really have no comment on the reports. Confidentiality is supreme, especially in a practice like mine where there are a lot of celebrity patients.
Dr. Mani is outraged that some physicians will operate on celebrity patients and fill their prescription requests because the patient is famous.
This should just be a wake-up call. It's very sad. We're all sad about it. We lost a great talent, and I wouldn't fault doctors for the whole process. But at the same time, I think we need to be more active in preventing this kind of thing from happening. It's important to me that celebrities be treated not as idols or, larger than life. They're not immortal.
And Dr. Mani was also very blunt in saying doctors should not become a part of a celebrity's entourage.